I'm Tommy Warhurst. This is Spotlight on Cullman, presented by my team, the Warhurst team at Hagamore Realty Group, and powered by Cullman Community Radio, Cullman's Live 95. In the spotlight today is Dr. Robert Smith of
Hello there.
SoundMind TMS here in Cullman. Dr. Smith, thank you for stepping in the spotlight.
You bet, Tommy. All right.
You've been a medical doctor for over 40 years. What led you to SoundMind TMS from regular practice that you had done for years?
Well, what happened was of course, I did family practice. I'm board certified in family practice, and that's what I did for years. I was the doctor over in Bluentsville for more than a decade. The last 9 years, I've switched into just emergency room work. So I've been doing that at Cullman, Decatur, Gadsden, different places. Any place you work, there is just a lot of depressed people that end up visiting the emergency room. They have to come to the emergency room. They're suicidal, or they're just terribly depressed or catatonic. As almost everyone here in Alabama is aware of, here in Cullman County, we are just terribly underserved for psychiatric care here in the state. I would dare say if we have 20% of the psychiatrists and psychiatric care that we need in the state of Alabama, I would be shocked. I was just talking with a mom this morning. She's got a son who's been admitted to Decatur West twice for suicide attempt. So she got him out of the psych hospital, can't get him into a psychiatrist. Can't get him in. Like it'd be 90 days or 120 days before she can get in to see a psychiatrist. And of course, she's already had 2 suicide attempts. So that's the kind of thing you run into, particularly working in the emergency room. You see all these depressed people. So I was very aware of the burden of depression. And as a family practice doctor, I mean, the number of people depressed. And as a family practice doctor, I'm sure it wouldn't surprise our listeners to know that probably 25% of the people that come into a family practice are either there for depression, or it's because they are depressed and it's compounding their diabetes, hypertension, heart disease. But there's depression. There's a high burden of depression. And so then I found out about this TMS stuff. And it's shocking or surprising to me that pulsing a magnetic field into your left prefrontal cortex, which is where really the seat of your personality and your thought, that pulsing that day by day for 36 treatments could get like 2/3 of the people out of this bad depression. And who would think it? It's almost harmless. You can't say that it's harmless, but we don't even hesitate to order an MRI on a patient in the emergency room as long as they don't have indwelling metal. And this is a magnet pulse, and so the benefit to risk ratio of this particular new modality is just super. And we here in Cullman didn't have one until I about a year ago got this thing in here, depression is a bad disease, especially when it's severe. People can't function, or they function but they are miserable, so they don't make good workers. They're not good at being a spouse, at being a parent, at being a church member. They're not doing too good when they're badly depressed. Antidepressants help a lot of people, but and psychotherapy from a psychiatrist, a trained a psychologist, a counselor help a lot of people. These things really work. But at the end of the day, about 1/3 of all the people that are badly depressed are not better after trying 4 or more antidepressants and going to psychotherapy. And that's where this comes in. And my point is this is another strong new tool to use in the tool belt for people that are badly depressed. And it happens to be really effective. Like 2/3 is a lot for any sort of medical therapy.
For sure. So for people who have tried medications, they've tried other treatments, and those haven't worked.
Yeah.
The Brainwaves machine here has a way to try a different kind of a treatment that is successful.
That is correct. That is correct. Brainwave, and there's 7 vendors out there that make these brain stimulation machines, magnetic stimulation machines. I really think this type is the best. That's why I bought it. It's cost a lot more than the others. But I feel it's easier to effectively use on the patient hit the target area in the left prefrontal cortex without missing and get better results. It reaches a little deeper, it reaches a little wider than the other type figure of 8 machines.
Some people may be used to thinking of electroshock, and this is completely different from that kind of treatment.
I appreciate you bringing that question up. So let's go into that topic. For people who are badly depressed, as I described, and have failed on antidepressant medications, they've been to the psychiatrist, they've had cognitive behavioral therapy, dialectic behavioral therapy, and they're still really depressed. All there was available up until 2009 was electroshock treatment. So when people were catatonic, just fatally suicidal, you could send them down to UAB or up to Huntsville. Almost always these patients are admitted to the hospital. It can be done as outpatient. Usually it's inpatient. For electroshock treatment, what you do is run a bolt of electricity or a shock of electricity through the gray matter, through the brain, and induce a seizure. The seizure itself is the therapeutic modality. And you give people a seizure every other day, like three days a week for 3 weeks, and it has a lot of efficacy. ECT is still done because it works too. There's about a 65% efficacy for ECT, so it really works. People just don't like it.
Right.
They don't like it, and it's expensive. You have to start an IV. You have to anesthetize the patient, paralyze the patient, because they're going to have a seizure. Shock them, have a seizure, then they have amnesia about that whole day. So every other day, they don't know what's going on. So it's a real confusional time for the patient, unpleasant just from a psychological standpoint. And then you got to go to recovery room, and of course they can't drive themselves home or they're admitted to the hospital. So it's expensive. It's distressing some to the patient and family, and it's expensive compared to now. And I would really like to see these in every county in Alabama. This thing works and it helps people. And with something like this, they can drive themselves to this office. They sit in the chair and get this treatment for about 20 minutes. So they're here in the office about 30 minutes. They do a total of 36 treatments, which is kind of like getting a chemotherapy regimen. It takes some time to get that brain woke back up, re-stimulated in the left prefrontal cortex. But they receive that treatment. They're awake. They don't have a seizure. They don't have amnesia and forget what's going on, and they can drive themselves home. So you don't have to have an additional driver, and that becomes a problem. And you don't have to travel to either Birmingham and Huntsville. That becomes a problem. So having it here local makes it very doable for people. And it's nearly as good or maybe even better than ECT.
And one thing that people may appreciate, if they're suffering from depression and they need treatment, they don't want a lot of other people to know that they're there for treatment. And one thing I like about you and SoundMind TMS here in Cullman is that it is very private. When a patient comes in, everything is confidential. They're not in a huge waiting room with 20 other people who are going through the same thing.
Yeah, it's true.
SoundMind TMS is right on Highway 157. Dr. Smith, if people just need to find out more information about SoundMind TMS, how would they do that?
The most effective thing is to go to our website. And so you just type in SoundMind TMS, Tommy, Mary, Sam, TMS, which is transcranial magnet stimulation therapy. But SoundMind TMS pulls up our website. I feel like it's a pretty good website. And of course, it's got our phone numbers and address and a lot of details on how TMS works and who's a candidate. So that's the best place to go. And you can, of course, I don't know if I'm going to tell the phone number, but we got a phone number. Call us.
If you're suffering from depression, you don't have to continue to suffer. You can have help right here in Cullman from SoundMind TMS. Dr. Robert Smith, thank you for stepping in the spotlight today, and thank you, for caring for our community and offering this service to folks.
Very good. Very good. Thank you, Tom. Thanks for being here.
You're very welcome.
Yeah.
This has been Spotlight on Cullman, presented by my team, the Warhurst Team Realtors at Hagamore Realty Group, and powered by Cullman Community Radio, Cullman's Live 95. I'm Tommy Warhurst. Thanks for watching Spotlight on Cullman.
Thank you.